Hi everyone, welcome to this YouTube space. My name is Oreoluwaa with a double A, and I make videos based on health, lifestyle, and faith. Today's video is a health-based video on endometriosis. I am your medical doctor. Stick with me. So what exactly is endometriosis? Endometriosis is a condition whereby the tissues that are similar to the inner lining of the womb begins to grow in other places, such as the ovaries, the fallopian tube, or the outer layer of the womb. It could be the inner layer of the pelvis. It could be any organ inside the person's body. Okay, so these tissues begin to grow in certain places where they're not supposed to grow and begin to cause issues. So every month, when the tissues that line the womb, the inner lining of the womb, when they begin to grow, these tissues that are found in several other places also begin to build up as well. But the difference is the tissues that line the inner surface of the womb, they get to shed, and that's when you see menstrual cycle. They shed and all these things find an exit route out of the woman's body. But for people that experience endometriosis, these tissues that are found in other places cannot leave the body, so they begin to cause pain and several other symptoms that I will explain later. So endometriosis affects about 10 to 15% of women of reproductive age, usually around the age of 30 to 40. That is when these things are being diagnosed, or that's when these women know that they have this condition. And also endometriosis accounts for about 30 to 40% of all infertile women. So we need to know about this topic and how we can handle it. So let's talk about the symptoms of endometriosis. The variation of symptoms that people experience is largely dependent on the location of the growth of these new endometrial tissues, or it's also dependent on how much these tissues have grown. So you can have people having various symptoms. People that deal with endometriosis might be asymptomatic. What that means is some of them might have zero symptoms. They might be absolutely okay, while some have severe symptoms, and I'll be explaining some. Some common symptoms that people experience include things like heavy and painful menstrual period. Some people also experience pain while urinating or pain while defecating, and this pain is particularly close to their menstrual cycle when it's about to come. Okay, another very, very, very common symptom of endometriosis is infertility. Because of this growth of endometrial tissues in different places, it could cause different symptoms. If the endometrial tissue is growing in the fallopian tubes, it could block the tubes. It could prevent the eggs from traveling from the ovaries to the womb for fertilization and implantation. So infertility is a major symptom of endometriosis. However, there are treatment methods and ways to go about it. IVF sometimes can be the answer to infertility for people that experience endometriosis. Might is what I said, so you need to discuss with your doctor. Then there are other symptoms like painful sexual intercourse, and then depending on where these things happen or where this endometrial lining grows, if it happens anywhere near the chest, they begin to experience chest pain, chest discomfort, inability to breathe properly. These symptoms can vary largely, like I said. Okay, but the very important and popular ones that people experience are heavy and painful menstrual cycle. If you experience something like that, then you probably need to discuss with your doctor if it's something that you shouldn't worry about, or if it's something that you should actually check and make sure that you're fine. Another major cause of infertility in women of reproductive age is what we call PCOS, polycystic ovarian syndrome, and I made a whole video on that topic explaining everything about it, so feel free to check out that video here. I'll leave a link here. So now let's talk about the diagnosis of this condition and how you can know whether you have it or not. Now, a lot of people do not diagnose this condition early like they should. A lot of people treat it as just heavy and painful menstrual period, and they just treat it like it's just a normal painful menstrual period. Meanwhile, in endometriosis, the pain is very, very severe. A lot of people have severe pain. That's how you know that it's critical. But like I said, some people do not have very, very severe pains. It varies, so it's not set in stone, okay? But something that really helps is ultrasound scan. It's the regular ultrasound scan, and this can pick endometrial tissues that are growing within the pelvis or anywhere around the abdominal region. But ultrasound scan might miss it depending on the location. If it's growing at a position where a scan might not be able to pick it, it will be pretty difficult to diagnose. But the first line and the basic thing for you to do or check is a simple ultrasound scan. That might be able to pick it up. But the gold standard, and what I mean by gold standard, is like the diagnostic method, the thing you do to actually get to the root of it in most cases, and that will be able to pick it, is what we call a laparoscopy. Now, a laparoscopy is a tool that can be used to visualize the inner organs of an individual without having to do a deep, big cut, to see what is actually going on. But this laparoscopy can also be diagnostic and therapeutic. What I mean by that is that it can be used to see where the problem is and help to remove the problem. Because these endometrial tissues that are growing do not have a way of exit. So this laparoscopy method can be used to get to where it is and actually help to clear out some of these tissues to relieve these symptoms for the individual. So now let's talk about treatment methods for endometriosis. The treatment of this condition is dependent on an individual. It's not the same for someone that has had 5 children or someone that has completed their family and someone that hasn't even had a single child and someone that wishes to have a child. These treatment methods would largely vary. The first and basic thing to do is what we call pain management. In pain management, anything is given to be able to make the patient feel better and to be able to, go about her daily activities without being in chronic pain. So that's why pain management is important. Next up is what we call hormonal therapy. Hormonal treatments vary from medications to hormonal copper devices that can be put into the womb. So oral contraceptive pills can be given to reduce the symptoms, reduce the heavy bleeding, and also help with the pain. The copper device that can be put into the womb also helps to reduce these symptoms. Lastly, the treatment method that can be considered for someone that has completed her family and no longer wishes to have a child is what we call hysterectomy. This is the procedure, the surgical procedure, the surgical procedure where they have to take out the womb, and all of these symptoms and problems are largely dealt with. I hope you've been able to learn 1 or 2 things from this video. If you have, don't forget to give this video a thumbs up, and if you have questions, drop them down in the comment section below. I will definitely answer as much as I can. Till I come your way in my next video, I am Oreoluwaa with a double A. I'll see you in my next video. Bye.